Hey guys, this is Dr. Hub. Today we are looking at the ovarian cancer and its staging. So moving on to S1, that is the stage 1, there is A, B, C. So what is A? A stands for the tumor confined to the unilateral ovary. So it is confined to the unilateral ovary. Next we move on to the stage B. Stage B means it is concerned with the bilateral ovary. And moving on, we look at C. C means there is a capsule rupture. There is presence of the capsule rupture. So capsule rupture, it's again divided into 3 sections. So C1 stands for the surgical spill. So C1 stands for the surgical spill. Then C2 stands for the pre-operative capsule rupture. There is pre-operative capsule rupture. So pre-operative capsule rupture, and C3 stands for the malignant ascites. So C3 is nothing but the malignant ascites. Next we move on to the stage 2. So under the S2, there is a stage 2, there is A and B. A stands for the extension to the fallopian tubes and the uterus. So this extension to the fallopian tube as well as the uterus. Then comes B. So in terms of B, it is nothing but the extension. So the extension is to the PID, that is the pelvic intraperitoneal tissues. So we are writing it as PIPT. Then moving on to stage 3. Stage 3, we will be writing it as S3. So in stage 3, there is A1, A2. So what is A1 and A2? So A1 means there is a positive retroperitoneal lymph nodes. So there is a positive retroperitoneal lymph nodes, RPLN. So retroperitoneal lymph nodes is nothing but it is para-aortic. It is para-aortic. And looking at A2. A2 stands for it is microscopic. So A2 is nothing but it is microscopic. It is extrapelvic. So it is microscopic, it is extrapelvic peritoneal deposits. Peritoneal deposits. Then comes type B. So under type B, it is nothing but a macroscopic peritoneal deposits. It is macroscopic peritoneal deposits. And this macroscopic peritoneal deposits will be less than 2 centimeters. So less than 2 centimeters or plus or minus the positive retroperitoneal lymph nodes. So what does it include? It includes the extension to the capsule of the liver or spleen. So it includes the extension. This is to the capsule of the liver or spleen. Capsule of the liver or the spleen. Then we move on to type C. So under type C, it is again the macroscopic peritoneal deposits. Macroscopic peritoneal deposits greater than equal to 2 centimeters. And again there is a plus or positive or negative retroperitoneal lymph nodes, RPLN. And it includes the extension into the capsule as well as the liver and spleen. So there is extension. And extension is into the capsule of the liver and the spleen. Next, we move on to the stage 4. So what happens in terms of this S4, that is a stage 4. In terms of S4 or the stage 4, A is there is a malignant pleural effusion. There's pleural effusion. And B stands for there is an extra abdominal spread. There is presence of the extra abdominal spread. There is extra abdominal spread, or there is also the inguinal lymph node involvement. There is the inguinal lymph node which is involvement. you.